Hello, my name is Tim Benson and I'm going to talk to you about our outcomes. When assessing quality of care, the traditional approach is to consider quality of care in terms of structure, which is the inputs into the system, process, which is what we do, and outcomes in terms of the impact on individual patients. Our outcomes has developed a family of simple, easy-to-use tools and services which track patient and staff and carer perceptions of health status, personal well-being, health confidence, and patient experience. These measures are all generically known as patient-reported outcome measures, and they form a coherent family of short generic measures which apply across all health and social care, irrespective of the patient's condition and type of care. How are you is a simple health status measure which captures how you feel physically and mentally and how much you can do. How are we is a patient experience measure focusing on their people's perceptions of the care and service provided. The health confidence score covers their confidence in their knowledge, ability to self-manage, to access help and to take part in shared decision making. And the personal well-being score is a measure of happiness or subjective well-being, and it's based on the Office of National Statistics personal well-being measure. And on the right you can see an example of the How Are You measure. This slide identifies some of the ways in which How Are You is different. It is all the measures are generic, which means they apply to everybody. They are short, which means they're quick and easy to use, and they're a family of measures which all work in the same way. In the table below, we can see how these relate to other measures you may have heard of, such as EQ5D, the NHS Friends and Family Test, the Patient Activation Measure, and the Warwick-Edinburgh Mental Wellbeing Score. We have focused on making them as short as possible. So here we have the name of each measure, the number of words and the reading age for each. And you can see that our outcomes measures are very short in terms of length and easy and have a low reading age requirement. We'll go through each of the measures in turn. How Are You is a short generic patient-reported outcome measure covering physical and mental symptoms, disability and dependency. And the scoring system used is the same throughout. If they score none, they scores 3, a little scores 2, quite a lot scores 1, and extreme scores 0. And to get an overall score, you add the scores together, and always a high score is better than a low score. This slide shows an example of validation tests where we have measured the actual How Are You score, which is the aggregate score, against the SF12 and the EQ5D scores. And you can see there's a really quite straight line. A straight line means that they are essentially measuring the same things. The personal well-being score is closely based on the Office of National Statistics personal well-being questions. There are four items. The first is related to life satisfaction. The second is overall worthwhileness. The third is related to how happy you were yesterday, and the final one is about your level of anxiety. And the scoring system is very similar to How Are You. The health confidence score is a short generic measure of your confidence to engage fully in health and care. And this is increasingly important. It covers how much you know, your knowledge, your ability to self-manage, your confidence that you can access the help that you need, and to be involved in shared decision making. And this graph shows a fairly straight line relationship with another measure, which is the My Health Confidence Score. How Are We is a short generic measure of patient experience, and it covers the first two items on the list are clinical, so they cover how your perception of the kindness, whether you were treated kindly, whether communication in terms of listening and explaining, while the final two are more administrative, covering whether you were seen promptly and how well organised the organisation was, which is really a measure of reliability. And the scoring system again is quite similar to the others. This is an example of a before and after. So this slide shows that the promptness and organisation of this particular organisation was not quite as good as the level of kindness and communication. But after we change it, on the next slide, after some changes, the promptness and organisation improved substantially, while the clinical aspects in kindness and communication stayed much the same. This slide shows a so-called funnel plot, and this is a study of 350 care homes, and the ones above the green line are statistically above average, and the ones below the red line are below average. So you can see straight away which care homes you'd like to send your granny to. When we're displaying the results, we often show the before and after. So the orange bars here are the before scores on referral, and the red bar and the green bars are the after scores after referral. And you can see most of these show significant improvements. What is perhaps interesting is that in this particular intervention, the personal well-being scores improve more than the health status scores, showing the effect that some of these interventions have on happiness as opposed to simply functional health status. The error bars are the confidence limits for each of these measures, which is how reliable they are. So where they overlap, where they do not overlap, then there is a statistically significant improvement. One of the problems we have is how you ask. There are some patients who are unable to answer questions directly. For example, they've got advanced dementia or they're near the end of life. And for these patients, we use a measure called How Are They, which is a staff or carers assessment of their needs and risk. And this covers their physical needs, their level of distress, and importantly for some of these people, their level of unpredictability and behavioural challenges, extent to which you can leave people alone, or how many people you need to look after them. This is an example of a self-care questionnaire which covers, this was really designed originally for use in patients with diabetes, the extent to which they are confident in being able to manage their diet, do enough physical activity, manage their weight, manage medication, and the extent to which self-care helps them live the life they want. There are lots of ways of collecting this information. You can use the person's own device via a text message or an email invitation, or you can use a smartphone, their smartphone or PC or tablet. Alternatively, the healthcare provider can provide a device such as a kiosk or a tablet or a personal computer, or you can do it on paper. You can use optical mark reading forms, which can be automatically read, or simple paper forms, or postcards, or you can ask the questions over the telephone. The best method depends actually on the local context. And it's the example on the right there is the use of How Are You on a mobile phone. Thank you very much for listening. My name is Tim Benson, and you can find more information on our website.